It will be free, Premier Doug Ford stressed that point yesterday during a news conference, except maybe paying for parking at the private clinics.
That's the only cost they're going to be seeing.
Well, Twitter went off. Doctors, nurses, and even comedians weighing in on the problems that might arise with the province's decision to start allowing private clinics to perform some procedures covered by provincial dollars.
Here in Canada, most of us are quite proud of our universal healthcare system. However, it's currently in crisis. And for that reason, some people, and I'll loosen the definition of people to include politicians, are suggesting that one solution to fix our healthcare system is to introduce private healthcare.
Canada's publicly funded healthcare system has in the past been seen by some as a model system. But critics say years of underinvestment and the strain from the COVID-19 pandemic have stretched it to a breaking point. The province says there are over 800 surgical and diagnostic private clinics in Ontario, and in an effort to ease backlogs at hospitals, the Ford government will be paying these clinics to treat Ontarians under OHIP. Sounds pretty good, right?
When it comes to your health, the health of all Ontarians, the status quo is no longer acceptable. We need to be bold, we need to be innovative, we need to be creative.
Dr. Amit Arya tweeting, how can for-profit surgical centers, which are OHIP covered, also make profits for investors or shareholders? Pressuring patients to buy uninsured services, aka upselling, overcharging government for the same services, and cutting corners on quality of care. How is this acceptable? CUPE, a union representing some hospital and long-term care workers, tweeting, Ford's plan to expand private clinics in Ontario will cost patients dearly, risk lives, and significantly worsen staffing shortages. Health Minister Sylvia Jones says when it comes to staffing, they have a plan for that.
So we're doing a lot of different pieces to make sure that we have sufficient health human resources across our entire sector, but we're also doing it in a short, medium, and long-term way so that we have more people interested in being trained, but we also have worked with the College of Nurses and the CPSO to make sure that individuals who are waiting to practice in Ontario get their qualifications assessed quickly and ultimately, when appropriate, licensed.
But despite the assurances from Jones and Ford, healthcare professionals in Ontario aren't convinced. Health policy researcher Andrew Longhurst tweeting, rebranding for-profit surgical and medical imaging centers as community clinics doesn't change the fact that they are still corporate, investor-owned businesses. And Dr. Nahid Dasani also chiming in saying spending more on private for-profit healthcare will not solve Ontario's healthcare crisis. Investing in our public healthcare system will. Ford says the changes are permanent.